Hi everyone, my name is Rachel Weldon, and I will be discussing the topic of hand-eye coordination in connection to children with autism. A little bit about me before we begin. I graduated last year from Westchester University's Exercise Science program and gained a certification in personal training. After graduating, I worked as a group fitness instructor until I decided to open my own mobile fitness company where I train individuals with intellectual disabilities. I also recently started a new training position where we train individuals with different disabilities. These include TBIs, strokes, and much more. Even though my career is not directly within the education system, a lot of the information from this program has been extremely beneficial. Moving into the topic, we will first focus on what is autism. Autism spectrum disorders, also known as ASD, are developmental disorders. ASD affects communication, behavior, fine and gross motor skills. Autism is termed a spectrum disorder because there is a wide range of types and symptoms that individuals experience. People with ASD tend to have a difficult time with social communication and interactions. When looking closer, in social communication and interactive behaviors, individuals with autism may make little or inconsistent eye contact. They have the tendency not to look at or listen to other people. They may rarely share enjoyment of objects or activities by pointing or showing. They may have difficulty with back and forth conversation. Some individuals with autism often talk at length about a favorite subject without noticing that others are not responding. Individuals with autism may have facial expressions, movements, and gestures that do not match what is being said. They also may have trouble understanding another person's point of view or being unable to predict or understand other people's actions. When looking at restrictive, repetitive behaviors, these may include repeating certain behaviors or having unusual behaviors. For example, repeating certain words or phrases. They may have a long-lasting, intense interest in certain topics, such as numbers or details. They may get upset by slight changes in their routine, and they could be more or less sensitive than other people to sensory input, such as light, noise, clothing, or temperature. Looking at the next slide, I'm discussing hand-eye coordination. Hand-eye coordination is the ability to do activities that require the simultaneous use of our hands and eyes. This is a complex cognitive ability. Hand-eye coordination unites visual and motor skills. The individual's hand is guided based on visual stimulation. The image below gives an idea of what areas are affected by hand-eye coordination. As you can see, balance, movement, control, education, synchronize, and harmonize, all body effects that happen because of hand-eye coordination. Next, we are putting the two topics together and seeing the skill of hand-eye coordination in children with autism. Children with autism can exhibit physical symptoms along with difficulties in social interactions. Some of the physical symptoms include a decrease in hand strength, low muscle tone, repetitive movements, and poor hand-eye coordination. Children with autism tend to avoid using their hands to engage in strengthening activities. Therefore, the avoidance typically lowers hand strength. Children with autism also engage in self-stimulatory behaviors, which are often repetitive and are often not appropriate motor responses to the task at hand. The self-stimulatory behavior can be performed with their hands, such as moving fingers in front of their face or eyes, pulling hair, thumb-sucking, or nail-biting. This video I added shows a few more examples of the self-stimulatory behavior. We won't watch the whole thing, but I'd just like to show you a little tidbit of a couple different ways that individuals with autism use self-stimulatory behaviors. I'm just going to keep scrolling down. There's a couple ones I wanted you to see here. He's making noise as of his behavior and also spinning. There's the boy using his hands again in behaviors that are not the same as the task at hand. They're clacking or ticking their fingers.
And the bluebirds, he did.
As you can see, the behaviors aren't always matching what the task they're trying to perform is. Here he's trying to eat his dinner.
You know, Ian used to do that when he was little. Yeah. Eating some dinner here. Whoa there, buddy.
You also have to be careful because some self-stimulatory behavior can also be dangerous. There's a motion coming up where, here it is, the little boy is hitting his head against a door, which you just have to be careful of his surroundings.
They stop doing things. Of course, he's banging his head on the glass now.
Alright, so I just wanted to show you a little bit more about the behavior. Now we can move on to why is it improving hand-eye coordination important for children with autism? Having age-appropriate balance and coordination allows the child to be involved in sport participation and helps with fluid body movements. Improving hand-eye coordination helps children develop and maintain controlled body movements during specific tasks and activities. Improving hand-eye coordination also aids in balance and physical coordination. Therefore, this would decrease the risk of injury and aid in proper postural responses if needed. For example, when falling, hand-eye coordination would allow a child to put their arm or hand out when falling to brace the impact. Next, I will focus closer on motor skills and how to make improvements in hand-eye coordination for children with autism. Autism manifests through behavior, which includes both fine and gross motor skills. Some treatments for improvement. In order to improve motor skills, such as hand-eye coordination, therapeutic activities should be developed and designed to help improve the body's ability to regulate motor control. The approach should break down a large task into simpler steps. Once each step is mastered, the program should move to the next goal until each step is completed, resulting in the completion of the large task. So how do you measure motor skills and hand-eye coordination? Since autism is a neurological condition, they often do not display obvious physical characteristics. The differences are mainly seen through brain function, which are not easily detected. Professionals rely on observing behavioral patterns, but assessing motor skill function can be difficult to measure. There are a number of reasons why motor skills are difficult to measure. The mental process cannot be physically seen, and the motor skill and hand-eye coordination can differ between different task activities being performed. Also, you must take into consideration children with autism often have sensory difficulties. Therefore, bright colors, lights, or sounds can cause distraction from the task being performed. So what are the steps to assess hand-eye coordination? Observations, the ability or inability to produce a specific action or task. Use activities to assess the body's movement pattern. Perform different exercises to assess different visual and motor skill connections. There also can be a link between motor skills, social skills, and communicative behaviors. The picture to the right is a woman who is using balloons in order to connect visual and motor skills. On to my critical thinking activity. If you didn't get a chance to print out the document, just take a minute now to think about these questions before watching the video. So while I ask each question, please think about what your response while watching the video would be after. So first, what do you think are the building blocks or techniques your body uses to develop hand-eye coordination? One example could be the necessary need for concentration. What are some techniques that can help develop hand-eye coordination? Have you considered the use of balloons when coming up with ways to improve this motor skill? And this is for after watching the video. Think about whether this technique that will be shown is beneficial and could you use this activity in your adapted programs. I had difficulty embedding this video, so I will now close the presentation window to show the video. So just give me 1 second to set this up. All right, turn this louder because she speaks pretty low.
Hello, welcome to Integrated Learning Strategies. My name is Elaine, and today we have Brady helping us. We are actually going to do a hand-eye coordination activity with balloons, and he's got these little pallets here to also hit the balloon with. So as you notice, he's going to be watching with his eyes, so when you throw a balloon up, you have to watch where it goes because it just kind of sometimes goes where you don't expect it. Also, balloons are great because they come down slower. So for younger children, it's great because then they can track. It gives them a little bit more time for tracking. So hand-eye coordination is really great in school for being able to read and track across the page as well as for writing and also for copying from a board. So Brady's going to be the star of our show today. He's going to be watching the balloon and see where it goes, and he's going to be moving around. He's going to be going right and left. So our green and then our orange, okay? Are you ready? Here we go, Brady. So that's a great fun activity for your children. If you don't have these little pellets, you can always just have them use both hands. Thank you and have a great day.
All right, so that was our video on the balloon activity, which we'll look at closer in just a minute. Lower that so I'm not screaming at anyone. So from the questions from the critical thinking activity, I asked, what are building blocks or techniques that are involved in hand-eye coordination? And on this slide, we will take a closer look at aspects that are necessary in order to develop balance and coordination. So we will first look at the need for attention and concentration. This would be the ability to maintain attention to a specific task for an extended period of time, as the core strength is not challenged. Body awareness. You would know your body parts and understanding the body's movement in space in relation to other limbs and objects for negotiating the environment. Bilateral integration, which would be using two hands together with one hand leading. Example is holding a tennis racket with the non-dominant hand, with the helping non-dominant hand holding and stabilizing only between hits. Crossing midline would be the ability to cross the imaginary line running from the child's nose to pelvis that divides the body into left and right sides. This also influences hand dominance. Now on to hand dominance, which would be the consistent use of one hand for the task performance, which is necessary to allow refined skills to develop. Muscular strength would be the muscle's ability to exert force against a resistance. Muscular endurance would be the ability of a singular muscle or group of muscles to exert force repeatedly against resistance to allow sustained physical task engagement. Self-regulation, which is the ability to obtain, maintain, and change alertness level appropriate for a task or a situation, which then allows them better attention. Postural control, the ability to stabilize the trunk and neck to enable coordination of the limbs for the controlled task. Sensory processing, which is the accurate processing of sensory stimulation in the environment, as well as in your own body for quick and physical appropriate responses. And lastly is isolated movement, which would be the ability to move an arm or leg while keeping the remainder of the body still, needed for a refined movement. And these are just a few aspects that are necessary for hand-eye coordination, and you can see that all of these aspects would be necessary when participating in the balloon activity. So now we're going to move on to the balloon activity we just watched a few minutes ago. So Eileen from Integrated Learning Services created this video to display the balloon paddle technique. The activity required the child to watch the balloon move and anticipate where and when to use the paddle. The technique focused on is using balloons and paddles to increase hand-eye coordination. The video displays concentration and connects the physical and mental work that needs to take place in order to complete the activity. Using a balloon is a great way for younger children or individuals that have difficulty with coordination. Since the balloon moves slowly, this would allow the child to have time to process the movement and therefore display appropriate reaction required. So which hand, which paddle needs to reach out to hit the balloon. And balloon tapping is a great skill that can be used for younger children and to also help prepare them for age-appropriate skills, which can begin to develop through this activity. So why should we use balloons for the balloon activity? Since children with autism often have sensory issues, balloons are a great, light, comfortable touch object that will not disturb their senses. Just be cautious that if a balloon pops, it may disrupt their sensory issues, or it might cause them to have a little outbreak because the sound of the popping tends to be very loud. Also, balloons tend to be slower moving in the air, thus allowing young children to develop the hand-eye coordination techniques slowly and progress to harder techniques. When looking at the pictures, you can see that the middle picture to the bottom is a simple hand to tap the balloon exercise. This is getting the child's use of where the hand should go in relation to that balloon connected. Then the balloon task can progress to using a cup to try and catch the balloon. So now we're taking away the simpleness of where should I put my hand. We're now adding the element of how to get the balloon to sit in the cup. And the last picture is using a balloon to engage in skills that can correlate to a sport. So up at the right over here, we can see that the balloon the educator is teaching volleyball skills, and the balloon should not drop on the floor, and the slow balloon is ideal for very young kids, which we discussed. But as you can see, they can learn volleyball skills through a slower motion and develop the proper hand-eye coordination techniques that are needed for sport. So in conclusion, my presentation discussed autism and the development of hand-eye coordination. We also looked at ways to make improvements, such as using the balloon activity. And lastly, the different ways balloon activities could help improve hand-eye coordination, as well as other areas that help aid and promote age-appropriate activities or tasks. So you could see how the balloon activity could help children of all ages, because you can focus on the simple balloon tapping activity, and then you can progress to using paddles, cups, and even engaging them in sport-related activities, such as the picture on the previous slide where they were practicing volleyball techniques. Here are some pictures on the bottom that just display the techniques we just talked about. So here he's using the paddle, which you saw in the video. The middle picture is the tapping technique. And the video on the right is actually using a straw to try and tap, or a light object to try and tap the balloon. This is refining the amount of space the object has to reach the balloon, so you really have to focus more on where the balloon's going to land, or where it's going to be located in order to touch the balloon with the object in the hand. Lastly are my list of references. Thank you all for listening to my presentation. I hope there was some information presented that is helpful or beneficial. I look forward to answering your presentation questions. Thank you.